Cefadroxil, Duricef uses, dosage instructions and side effects. Cefadroxil, available under brand names like Duricef and Ultracef, is a first-generation cephalosporin antibiotic. It's commonly prescribed to treat various bacterial infections including those affecting the urinary tract, skin, and throat. Known for its effectiveness and broad-spectrum activity, cefadroxil tablets are suitable for adults, older children, and pregnant women. What is cefadroxil? Cefadroxil is a cephalosporin antibiotic which is used for treating various types of infections that is caused by bacteria. It is also used for treating bacterial infections such as urinary tract infections, skin infections, and throat infections. The medications are suitable for adults, older children, and pregnant women. What are the benefits and uses of cefadroxil? Cefadroxil is an effective solution for combating a wide array of bacterial infections, making it a vital choice for those in need of reliable treatment. Conditions cefadroxil treats. Cefadroxil is commonly prescribed for urinary tract infections, UTIs, skin and soft tissue infections, pharyngitis, sore throat, tonsillitis, respiratory tract infections, streptococcal infections. The antibiotic is particularly effective against specific bacteria including Staphylococcus aureus, Streptococcus pneumoniae, Streptococcus pyogenes, Escherichia coli, E. coli, Klebsiella species, Proteus mirabilis. Secondary uses of cefadroxil. Beyond its primary applications, cefadroxil is sometimes used for preventing infections after surgery, preventing heart valve infections in certain penicillin-allergic patients undergoing dental or upper respiratory tract procedures, long-term treatment of recurrent urinary tract infections. How does cefadroxil work? Cefadroxil operates through a specific mechanism that disrupts bacterial survival. Understanding this process helps explain its effectiveness against certain infections. Cefadroxil works by inhibiting bacterial cell wall synthesis. The drug binds to specific penicillin-binding proteins, PBPs, located inside the bacterial cell wall, causing the inhibition of the third and last stage of bacterial cell wall synthesis. This action prevents bacteria from forming their protective cell walls, which are essential for survival and reproduction. Unlike many antibiotics, cefadroxil specifically targets the peptidoglycan layer in bacterial cell walls, a structure not present in human cells. This selective action allows cefadroxil to kill bacteria without significantly damaging human cells, contributing to its safety profile when used appropriately. How to take cefadroxil. Dosage and administration guidelines. Cefadroxil is available as capsules, tablets, and suspension. Here's how to take it effectively. Form: capsules, tablets, and suspension. Frequency: every 12 to 24 hours. With food, recommended to reduce nausea and stomach upset. Consistency: take at the same time every day. Cefadroxil dosage. Proper dosing of cefadroxil is crucial for treatment success. The medication is available in multiple forms to accommodate different patient needs and conditions. Cefadroxil comes in capsules, 500 mg, tablets, 1000 mg, and oral suspension, 250 mg per 5 ml and 500 mg per 5 ml. Dosages vary based on the type and severity of infection, patient age, weight, and kidney function. Typical dosage instructions. For adults: urinary tract infections, 1 to 2 g per day in single or divided doses. Skin infections, 1 g per day in single or divided doses. Pharyngitis and tonsillitis, 1 g per day in single dose for 10 days. For children, the recommended dosage is typically 30 mg per kilogram per day. For children under 40 kilograms, 30 mg per kilogram daily is a single dose or in 2 divided doses. For children over 40 kilograms, same as adult dosing. What should I do if I miss a dose? If you miss a dose of cefadroxil, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. What happens if an overdose? Accidental overdose of cefadroxil can lead to harmful effects. Symptoms may include nausea and vomiting, severe stomach pain, diarrhea, seizures in severe cases. If you suspect an overdose, seek emergency medical attention immediately. What are the side effects of cefadroxil? Like all medications, cefadroxil can cause side effects, though not everyone experiences them. Most side effects are mild and temporary, but some can be serious. Common side effects: diarrhea, vomiting, genital itching. Serious side effects: stomach cramps, rash, itching, hives, breathlessness, wheezing, sore throat, dark urine, seizure, kidney problems. If you experience any serious side effects, contact your doctor immediately. While most people do not show adverse reactions, it is crucial to monitor your health and seek medical assistance when necessary. Precautions and warnings. Certain individuals should use cefadroxil with caution or avoid it altogether. Being aware of these precautions helps prevent potential complications. Who should avoid this medicine? Cefadroxil should not be used by individuals with known allergy to cefadroxil or other cephalosporin antibiotics, previous severe allergic reaction to penicillin antibiotics, use with caution, history of cephalosporin-induced hemolytic anemia, conditions where caution is needed. Use cefadroxil cautiously if you have kidney disease, dosage adjustment may be necessary. History of gastrointestinal disease, especially colitis. Phenylketonuria, PKU, some liquid forms may contain phenylalanine. Bleeding disorders. Are there any age restrictions for using cefadroxil? Cefadroxil can be used in all age groups, including children. However, dosages must be adjusted based on weight for pediatric patients. For elderly patients, dose adjustments may be necessary due to age-related decreases in kidney function. Alcohol or food interactions. Taking cefadroxil with food can help reduce stomach upset. While no significant interactions with alcohol have been documented, drinking alcohol while taking antibiotics is generally not recommended as it can reduce their effectiveness and increase side effects. Possible interactions with other medications. Cefadroxil tablets may interact with certain medications, potentially affecting treatment efficacy or increasing the risk of side effects. Cefadroxil has been reported to interact with several medications. Probenecid may increase cefadroxil levels in the blood by reducing its elimination. Oral contraceptives, cefadroxil may decrease the effectiveness of estrogen-containing birth control pills. Live bacterial vaccines, cefadroxil may reduce the effectiveness of these vaccines. Blood thinners may increase the risk of bleeding when taken with cefadroxil. Metformin, potential interaction affecting blood sugar levels. According to Medscape, there are 46 drugs known to interact with cefadroxil, including 6 major interactions and 40 moderate interactions. When taking supplements or herbal products, inform your healthcare provider as these may also interact with cefadroxil. Particularly, high doses of vitamin C might reduce the absorption of the antibiotic. How should cefadroxil be stored? Proper storage ensures the effectiveness and safety of cefadroxil. Recommended storage temperature. Tablets and capsules store at room temperature between 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. Suspension, after reconstitution, refrigerate and use within 14 days. What happens if cefadroxil is not stored properly? Improper storage can lead to decreased effectiveness of the medication, potential growth of harmful bacteria in liquid formulations, chemical breakdown of the active ingredient, possible toxic byproducts formation. For the oral suspension, discard any unused portion after 14 days, even if it has been properly refrigerated. Keep all forms of cefadroxil out of reach of children and pets. Store in a safe location away from moisture, not in the bathroom, and direct sunlight. Do not freeze the medication. It is an effective antibiotic for its success in treating a range of bacterial infections. Under proper usage conditions and precautions, the drug can not only cure an infection but do so without any undesirable side effects. The dosage, course, and special safety notes all need to be respected if cefadroxil is to achieve its goals fully. As such, always follow the instructions given you by physicians or other healthcare providers. After all, you want maximize benefits and minimize possible side effects at both times. Important warnings for serious health conditions. Special considerations for specific groups. 1. Pregnancy. Cefadroxil has not been extensively studied in pregnant women. Consult your doctor before use. 2. Breastfeeding. Cefadroxil passes into breast milk and may cause side effects in breastfeeding infants. Discuss with your doctor before taking cefadroxil if you are breastfeeding. 3. Kidney disease. The drug may remain in your body longer if you have kidney problems, increasing the risk of side effects. 4. Liver disease. Consult your doctor, as the medication is processed by the liver and may lead to increased side effects. By following these guidelines and consulting your doctor, you can ensure the safe and effective use of cefadroxil to treat your bacterial infections.